emotions.
Yeah. And so that's the role of emotions. That's what emotions are there for. They're our guides. And we need them. So when we think about, so again, from a cognitive behavioral perspective, I would say that your shadow sides are connected to your core beliefs, right? And we all have core beliefs and we all have core needs. We have the need to be loved, we have the need to belong, and we have the need to be comfortable. Those are like some of the top three kind of needs that human beings have. And they show up in different ways, right? So when, for example, I have an experience in where, through the grapevine, that core belief of maybe I'm not loved, maybe I'm not normal, maybe I don't belong, maybe I'm, I can't stand this discomfort. This is so hard. When, and look, most human beings, you get maybe one, maybe two. Sometimes you get all three activated. And sometimes if you're like me, you get three in somebody else's. And so a whole bunch of like little Christmas trees light up and you're like, whoa, that's intense stuff.
Yes.
But then you get to go explore. And you're like, what was it? What was about this situation or this experience that I'm having that is telling me that this is so intense? What has been activated? And so then we can go and we can be like, oh, well, am I really unloved? Is that at the core of this? This is what I fear will happen, but hold on a minute. Thank you for letting me know. And so, our emotions give us a kind of a signpost. Hey, something's up. Now, if I leave that unchecked, right, it's just going to keep on giving you the same message. Hello, pick up. Hello, pick up. Hello, pick up. Hello, pick up. Pick up. For heaven's sakes, pick up.
Yeah.
And so that's when we feel overwhelmed. Yeah. And we feel that our emotions are controlling us or out of our control. Because what's happened is that we've avoided them and discarded them and dismissed them and pushed them away. That by the time they come back into our awareness, they are kicking and screaming at full force because this core belief that got activated is shining really bright and it really needs to be addressed. And so one of the questions you posed to me was, how are we meant to be in control of our emotions, or are they meant to control us? Neither. This isn't about control. This is about familiarity. Our emotions are signals to help us be more curious. They don't belong to us. They are just information that is coming through us.
Yes. So we can start to sort of separate or just give some spaciousness to emotions now being a sensation. Simply information.
Simple information.
That's it.
And it's not so scary now.
Opportunity to inquire and explore, like you said.
Yeah, exactly. So again, if you come and you sit in my office or on our telehealth opportunities, I'm going to ask you about your thoughts and your values and your beliefs. If they come to you, you'll probably do more spiritual work. And you'll be like, I've been with you, I've worked with you, and you help us tap into stuff. It's the same work. Just that I have a bit more registrations and insurance to pay, I think. But essentially, that opportunity to inquire can be done with so many different modalities.
Yeah.
It can be done with ancestry work. It can be done with lineage work. It can be done from a, racial, social, economic perspective. It can be done through a light perspective. It can be done through a spiritual practice. It can come from a religious practice. There's no wrong way to inquiry.
Yeah.
It's just ensure what is our intention of inquiry. So if we're inquiring because we want to get rid of things, of these experiences that are important and innate in us, these are the things that kept us alive, then the answer of it will never happen to you again will never come and you will be disappointed.
Mm.
So we need to start to learn how to be with the internal experiences we have with acceptance and compassion.
Yeah. Oof. Just one of the most biggest messages that I have to bring to the community is, and I heard it in a song. It was a part of the lyrics, and he said, "To let go is to let it in."
Mm-hmm.
And I think you've been explaining it throughout the whole time you've been talking, but allowing this sensation to be information and to actually sit and be with it, so that you can let it in and experience what that's like, and go in and check some boxes, ask some questions.
Yeah.
Don't be afraid. And start to relearn that this is okay too.
Yes.
And there's going to be a peak and a trough.
A peak and a trough. And neither is better or worse.
Yeah.
It just is.
Yeah.
So a lot of the work is about, so when people say or come to me saying that they feel really overwhelmed with their emotions, what they're really saying is, I don't know myself.
Yeah. Yeah.
I live here, I live in this body, but I don't feel like I belong, and I don't really understand it.
Yeah. Yeah. That's so beautiful. And yeah. Yeah. Yeah.
And so,
And it's so vulnerable to be able to sit there and say that,
well, it takes a few sessions.
Yeah. So with someone who's just gone, oh my God, whoa. So where do I start? What do I do now? Okay. So I'm starting to learn that an emotion is just information, and I need to now inquire and go check some boxes. So where do I start? What do I do?
Ready? You're going to laugh. Sit down and breathe. Sit down, stay still, and breathe. Just open your awareness. That's where we start. So there's no inquiring or learning about self is not about doing more. You know, we're caught in this culture of, I have to do something to fix me. No, you're not broken. Yeah, stop. You sit down there and take a few deep breaths, and we're going to learn about our mind.
Someone at that point in time, I want to congratulate them and not say, oh, whoa, you got a lot of stuff. Let's fix you now. It's like, no, I want to congratulate you. Well done for recognizing this.
Yeah. Whew, we got here.
Yeah.
This is good enough.
Yeah.
So a lot of the work I do is about helping people breathe, which is hilarious because we all think we know how to breathe, but no one knows how to breathe really. Breathing is really powerful. So when we sit and we meditate, we know that there are neurobiological changes. We have enough data already to know that sitting and meditating changes the brain. And if we change the brain, that is an opportunity to change how we are in the world. Because again, our brain is part of our body, which, look, some people say that that's where the mind is. No one has ever seen the mind. We know that there are eye structures. There's a whole kind of prefrontal medial area here that's connected with eye. So all of the things that pertain to us get stored here, but that's not the soul.
Like when you say I, the things that we identify with, I am a yoga teacher, I am a psychologist.
I am, this is my hand.
I am the younger sister.
I. Anything with I, me, mine gets processed right here. That starts to light up. But is that our mind, our soul, our spirit? Nah. And I say this with great confidence because that is energy. So it encompasses all of us, from our little pinky toe to this little curly hair. Our spirit is within everything. We are all of us. Big, large, small, purple, green, yellow, it doesn't matter. All of us, all of this is information. And so people get really hooked up on, I need to change my brain, or I need to change. No, what we need to change is how we are interrelated with ourselves. So people with more concerns or issues with their bodies or experiencing more psychological distress, one of the things that we know is that there's a greater disconnection within the brain structures. And so what that means is that there is more, some parts of the brain are more connected and firing more often than others. In particular, the amygdala, which is the kind of headquarters of the emotions. So again, I'm not a neurobiologist nor a neuropsychologist, so I have really rudimentary neurobiology, but here I'll give you a little demonstration. So this is your brain. Oops, can you see me? There we go. We'll do it this way.
Yeah,
that one.
Yeah.
And so this is the kind of the wrinkly bits on the outside of the brain, the cortex. And then when I open up my hand, there's like a little bump here, and that's the amygdala. And this little amygdala kind of that connects there to the lower parts of the brain, so the cerebellum, so that kind of part over here. And then this is our spinal cord, right? Yeah. So this is our little brain. Lower parts, high parts. Lower parts keep us alive, breathing, standing, walking, fine motor skills. The little HQ here, these are our emotional center. And as you can see, all the information that comes up from our body has to pass through this guy.
Wow.
And my hand's not perfect, but the memory center of the cortex is sort of over here. So it's really close to the amygdala. And then that's when I have all my language skills, all my making decision skills, how to count skills, compare and contrast. So all those kind of more high order skills are up here. Now, if the information from the body comes in and this brain starts to freak out, he literally flips the switch. So you lose connectivity with all these kind of high order things, right? Wow. And so you're all reactivity, you're all emotion.
Holy.
Yeah. And our job, because this knows better, this is 64 billion years of evolution. This is like whatever your age is, right? So in my case, it's 40 something years old. Guess who's better? And your body's like, bang, off you go. Wow. Now, what happens with people who experience higher degrees of psychological distress is that their amygdala is inflamed. So think of it as an overreactive, what's the thing called when you crash and the air thing?
Airbag.
The airbag. So that's what the amygdala is when it's inflamed.
Yeah.
So every time you go over a speed bump, poof, every time, poof, poof, poof. And so you're flipping your switch all the time. So when we try and when we think about embodiment or therapy, what we're doing is we're trying to go, okay, hey, amygdala, I need you to calm down. I need you not to be so reactive. And so that I have at my service my entire system, not just my logical brain, but all of my system working together. We now know, some research came out of the Massachusetts Institute of Mindfulness, and Harvard, I think, was the last publication, where they measured people who pre and post a meditation course. And the subjects engaged in at least 80 hours of mindfulness of breath. Which is different from relaxation. And I don't know about any other meditative practice, but with mindfulness of breath. And we were able to see, well, they were able to see, not me, I wasn't part of it, that the amygdala started to reduce in size. So it was becoming less inflamed. And then when they asked the subjects, they too were starting to make decisions differently.
Yeah. Yeah.
And so the research poses is like, okay, what was it that they did differently? It was mindfulness of breath. Because mindfulness has a very unique characteristic of doing 3 quite high cognitive tasks. So one is awareness. So I need to be able to pay attention. The other is to then inhibit a response. So when you're in meditation and when you're doing long meditation, especially mindfulness of breath, and where you're sustaining your attention on your breath, you get bored, you get uncomfortable, you get tired, you get itchy, and the task is to return your attention to the stimulate, the breath, not to itch your itchy knee. I always get an itchy knee. So not to itch your knee, not to shift around, not to distract yourself in any ways. And so you're inhibiting responses that you would normally just reactively do.
Sure. So that's helping you reduce the inflammation of the amygdala and help training you to have all of
it at your service,
making skills at your service while still in the emotion or the sensation, so that you can receive the information and then you can decide what to do with it.
Exactly. The third component, which is really hard, which sounds the easiest, is that during mindfulness and breath, you're also implementing strategies of self-compassion. So you're actively engaging in kindness. And the more you train in kindness, the less reactive you become. You don't become a doormat, you don't become insensitive to things, but you are able to then be more present and respond more with kindness. So it's a pretty powerful thing, and all you have to do is sit there and breathe.
Yeah. So how long was this for? How long was this thing that they were doing that for?
So they meditated, or they calculated meditation of 80 hours.
And how long in the actual sitting?
So I think it was they had to do 1 or 2 practices a day of mindfulness of breath.
Yeah.
I can't recall in this study exactly. I'm trained in a protocol that's called Mindfulness Integrated Cognitive Behavioral Therapy, which was developed here in Tasmania. And our recommendation is a 10-week course and you meditate twice a day for 30 minutes a day.
Wow. And
you're doing no visualization, so it is. So that's sort of the hard part. It's, you really are becoming aware of yourself. You're doing a lot of mindfulness of breath and lots of body scanning, which can be really confronting because, well, all of us is in our body. And so when we visit places in our body, it might be holding on to stuff.
Wow.
And so learning compassion is really important so that we can inhabit our body.